Thank you, Nora, for the introduction. I'm going to dive in and just ask any of you who have looked at Support Act in the website. Just raise your hands. Yeah, okay. Have a look, because I think you will find it very useful. They're just exercises that can help you, especially when you've just been diagnosed with CLL or going through your treatment or in remission. Because a lot of the time we feel very anxious because of the uncertainty that we are facing. And I think some of the exercises could be very helpful to all of you. I developed Support Act for the charity just after the pandemic. It's a collection of well-being exercises designed to help you with the emotional and psychological impact of being diagnosed with CLL. And it's based on the principles of ACT, as Nora has mentioned. It's called Acceptance and Commitment Therapy. So twice a month, I hold drop-in sessions on a Tuesday morning and Tuesday evening and a Thursday morning. Yeah, correct. And also I do one-to-one sessions. The one-to-one sessions has very limited spaces. So, and I think the charity pays for 6 sessions. So, you know, if you think that you would benefit from one-to-one sessions or drop-in sessions, please let Cherry know, and she's the one who coordinates everything with me. So what is ACT? Acceptance and Commitment Therapy is a proactive form of psychotherapy that has roots both in traditional behavior therapy and cognitive behavior therapy, or CBT. So the overarching aim of ACT is to help you develop psychological flexibility. So what does this mean? ACT recognizes that life is full of challenges. With ACT, you develop skills that will help you deal with the challenges. ACT will not let your challenges go away. It's not like a magic wand and your challenges will go away, but what it will do is it will help you learn how to respond to them so these challenges don't get in the way of you living your life. So the Support Act drop-in sessions and the one-to-one sessions are tailored for you to help you during the time of your diagnosis, your treatment, and during remission. The physical and the mental shock of being diagnosed with CLL is a traumatic event for many individuals. As any cancer diagnosis, it is likened to a natural disaster or a trauma. A study has been done in 2018 with people with relapsed CLL, individuals who relapsed CLL. And they reported that they felt traumatized when they were diagnosed and when they had a relapse. There's also a study that was done that likens the experience of trying to get back to normal life after the treatment ends. And it mirrors the experience of combat soldiers who had been at war and they have come home. Although the immediate crisis is over, they're no longer at war, the sense of security has been shattered by the experience of being at war, leaving them feeling very unsettled and vulnerable. And then there's also the experience of those of you who have had treatment, but the treatment hasn't ended and who are taking medications. And actually, I was asking Samir, what medications could this be? He said, oh, there's the acalabrutinib. Sorry, I'm not very clever about the medications. So those medications that you take that are monitored, you take them, you're monitored until your disease progresses. So for those people as well, the trauma is never over because there's always a reminder that there's something that is wrong with me because I am still taking these medicines. So this trauma that I talk about shatters our sense of security. It makes you feel vulnerable. It makes you feel disempowered. It makes you feel helpless and hopeless. And it makes you feel very uncertain about the future. And there is nothing more stressful than uncertainty. So what can you do when you're feeling this way? To find health, one goes on a journey, and it is to get to know oneself. And that means you have to, it means rethinking and recognizing. And when I use the word recognize, it's recognizing, it's to know again your lives. And I think the gentleman asked over there, how about, the psychological, looking at my life as a whole. To find health, you have to look at your life as a whole. You can't only look at one part of your life. So you have to recognize those autopilot behaviors and habits that did not serve you well and that contribute to the stress that you are experiencing now that you have been diagnosed with CLL. You need to develop the capacity to respond to the stresses that you're having without rigidity, with flexibility and with creativity, without being incredibly anxious or overwhelmed by emotion. And at the same time, be able to live a life that is focused not solely on your illness, but also on your wellness. Because sometimes when we are ill, we forget that there are also other parts of us that are working okay, that they're working fine. It is important to see beyond your disease, beyond your medicines, and recognizing that you are larger and distinct from your experiences that come and go, and live a life that matters to you. So how do you do this from the perspective of emotional and psychological healing? So it is getting to know, it's through getting to know your mental habits. So I'm sure that all of you have smartphones, right? You all have smartphones? Yeah. And we all know how to work our smartphones, yeah? We're so good at it. But then again, if I ask you, how about your mental? Are you aware of your habits, of how you respond? So is that me? All right. Are you aware of your mental habits? And people will go, actually, I'm not so sure, yeah? And the thing is, your life is actually controlled by what you focus on. It is important to be aware, to create an awareness of the habits that we have. So I have a jar here, which represents our body, okay? The water represents our mind, and our brain, through evolution, is structured and functions in a certain way, and it predetermines how we see things. So we see ourselves not inside our heads, but we see ourselves as connected to the world around us. Yeah, you don't see inward, you see outwardly. So in this analogy, your brain sits in the water of your mind, okay? So our minds are not crystal clear. They're not as crystal clear as this, okay? So we have a lot of content in our minds. Do you agree? Yeah. Okay, so we have acquired this content through the years, through our childhood, our education, through our life experiences. And we also form beliefs, we form conceptions. Some are pretty strong, and so I'm going to use my wax over here. Okay, so we have a lot of content in our minds, and through, that we acquire through our childhood, our education, and our life experiences, and we form beliefs, conceptions, and some of them can be pretty strong, and they're represented by these rocks. I can show you. Some of them are a bit rough, some are a bit smooth, and some are pretty, some are well-formed, okay? And so I'm going to put them all in here. Okay, so they are there. They're hardwired in our brain, in the background of our minds, and we are not actually aware of them. We're not always aware of them, but they color the way we see the world around us, okay? Then we have our thoughts. Because we have a lot of thoughts that color our perceptions in a more obvious way, okay? And this is sugar. Some thoughts are pleasant. I put salty. My children tell me I'm salty when I'm not very nice to them. Some are not so pleasant. Okay? And some are fun. These are little stars for my daughter when she makes cupcakes. Some are fun. Put them all in there. That make life interesting, okay? So because of this, our mind, in a normal state, is actually always agitated, yeah? And we are not able to appreciate everything around us, yeah? And it's always agitated by something or another delivered to us through our five senses. So if I have this beautiful flower here, and it comes into our visual field. And if our mind is a little bit hazy or agitated, you cannot actually see the detail of the flower. Okay? So how do we begin to see things with more clarity? We learn to gain clarity through calm stillness. And how do we achieve this? And it's through mindfulness. I know people would have heard of mindfulness because it's the in thing at the moment, but it is through mindfulness. And ACT is a mindfulness-based behavior therapy. When we become agitated, we ground ourselves. We need to ground ourselves so that we can allow the content to settle down, for our minds to settle. And one of the ways of doing that is, which I teach in the drop-in sessions and in the one-to-one sessions, is to focus on the breath. Focusing is different from concentrating, okay? So concentrating, like me, if I'm concentrating on holding this, it's effortful. And sometimes when you're concentrating so much, you can agitate it, and it can create more agitation, okay? I'll try not to, to spill that. So it's letting go of the struggle, of the effort. So not being too relaxed that you fall asleep, because if you're asleep, you're not aware of anything around you because you're asleep. But aware enough that you're aware of what's going on, what's going on inside you and in your head. And once the contents settle, we get more clarity, but it takes time and practice. We also gain clarity if we are able to achieve the calm stillness of what the life we want for ourselves, despite the challenges we face. It gives us insight. We do not become so reactive to the thoughts and feelings that are unsettling us, and they do not dictate how we decide to behave and how we lead our lives. So, to give you a flavor of what mindfulness is like, I am actually going to do a short mindfulness session with you now. So, I'm going to cover this. So, if you look at the jar, actually it's beginning to settle now as I speak, but let's see what it's like if it becomes a bit clearer after our meditation. So, if you all sit comfortably, both feet flat on the floor. Okay, find a position that feels both relaxed and alert. And I'd like you to either close your eyes or look downwards. Looking downwards, closing your eyes just to limit the distraction that you have. And rest your hands in an easy, effortless way. Take a few moments to scan your awareness through the sensations of your body. Soften and release obvious areas of physical tension. Relax your breath. And breathe in through your nose, slowly and deeply. And out through your nose again. This may be unfamiliar to you, but when done in a natural, easygoing way, it can be a very relaxing way to breathe. In through your nose and out through your nose, slowly and deeply. Slowly in through your nose and out through your nose. And just finding your own pattern of breathing, slowly and deeply. Let your belly be soft. If the belly is soft, more oxygen goes to the bottom of the lungs, and there's better oxygen exchange. And it goes all the way to the cells in the body, including the cells in the brain, supplying your brain with the nourishment it needs. If the belly is soft, it helps to activate the vagus nerve. The vagus nerve is a nerve that wanders through the abdomen and the chest and back to the central nervous system in the brain. And it promotes relaxation. It's called vagus because vagus means wandering. So just carry on breathing slowly and deeply as I talk you through the meditation. This is a good antidote for the stress response. Breathing deeply and activating the vagus nerve helps relaxation to come. And as the belly is soft and you breathe deeply, all the other muscles in the body begin to relax as well. And hopefully you can start to feel that now. Sometimes it helps to think of the word soft as you breathe in and belly as you breathe out. So try it and see what it feels like for you. Soft as you breathe in and belly as you breathe out. If thoughts come, let them come, and gently bring your mind back to soft on the inhale and belly on the exhale. If your mind is beginning to wander and it's getting a bit impatient, coax it back, bring it back to your breath, like you would do a little kitten that's a little bit curious. It's just doing what it naturally would do. Your mind likes to wander. Just bring it back and help it learn to refocus. Soft as you breathe in and belly as you breathe out. Still with your eyes closed or looking downwards, I'd like you to slowly bring your attention into the room. Notice how you feel and notice what's changed. You may feel a little bit calmer, and if I have a machine, I might notice that your heart rate might be a bit slower. Maybe your shoulders are a little more relaxed. Have a few more deep breaths. Just notice yourself back in the room, to the noises around you, to the temperature of the room, and when you are sitting. Have a few more deep breaths. And when you're ready, you can come back to the room and open your eyes. Are we all back? How was it? Any comments? Anyone feel a change in them from before the meditation and after the meditation? Anyone? Yeah? How are you feeling?
I feel calm. I feel less afraid to go back.
This actually tells you that you can actually influence how you feel, that you can do something about it, yeah? Just by having the calm stillness. So mindfulness is the process of settling the mind, and it is the first step, but it requires practice. And Support Act will help you gain more clarity and insight, allows you to understand the contents of your mind, its processes, so you can choose actions that are based on how you, not based on how you're feeling or thinking about, but on the things that are really important to you, that what matters most to you, so that you can live a rich, full, meaningful life despite your challenges, despite having CLL. Thank you.